optimistic that in the next 5 to 10 years, most patients with hepatitis C infection will be cured.
Difficult, but not impossible.
We all know about HIV, but very few people know about hepatitis C.
There are 45,000 people in Canada infected with AIDS. There are about 300,000 infected with hepatitis C, and there are about 300,000 with hepatitis B.
Fortunately, there is a vaccine for hepatitis A and B, but for hepatitis C, there currently is no vaccine.
Both of these viral infections can cause liver cancer, and liver cancer has a very high fatality rate.
The first aspect of my research, we're looking at why 50% of the patients that go on to therapy don't actually have a positive outcome from the therapy.
We always knew that African Americans have a very poor response to therapy, and Asians have quite a good response. The poor response is about 20% get a good response in African Americans, and Caucasians around 50%, and Asians around 70%. And there is a particular gene that says these people respond, these people don't.
And unfortunately, most of the patients that we have in Alberta have genotype 1 of the virus. About 50% of the patients that have the genotype 1 have a negative treatment outcome. With the assay that we've developed, we can actually start screening patients to see if they'll actually be a positive outcome from the treatment or not. Because the treatment is actually a lot of side effects. So people don't want to do the treatment, so they wait until end-stage liver disease is coming in. So we could have an immediate impact with that research. But more specifically, we'd like to look at, see what's actually happening, why is the treatment not working.
And if we can understand the molecular mechanisms, we may be able to convert that from a 50% response rate to a 90 or 100% response rate. And Brad, with his skills on genotyping of these particular cells, has been very important to complement some of the work that's been done by other people in the lab.
The other aspect is looking at the more chronic patients, why they get negative outcomes or end-stage liver disease. Why does their liver start to shut down? We have a theory that possibly the cells in the liver are becoming more like a different cell type, and then they're becoming more fatty. And if this is true, then there actually are 9 different treatments that people could try. So depending on how this angle of the research works, then we could start looking at treatments for those patients with those therapeutics.
I think we have tended not to emphasize enough the importance of postdoctoral fellows. Graduate students and postdoctoral fellows and trainees are critically important to anybody's research program. When I look back on my research program over the years, every key discovery that has been made has had the fingerprints of key graduate students or postdoctoral fellows on it. The universities are going to need a new wave of fresh blood, and that will come out of the postdoctoral fellows.
I think basic research is key to all research. There's a big drive now to have only clinical research, but unfortunately, if that was the case, if we only had clinical research, we couldn't have the big breakthroughs that we want to have. I mean, there's a wealth of information that is out and published that we draw from currently, but we're always building upon this. And if we didn't have the basic research to build from, we wouldn't have the game-changing research that could really bring about curing 170 million people with hepatitis C.